deficiency. Okay, there's so many, incredible. This one is very common for tennis player, golfer. So it's got a name like this, tennis elbow, which is actually the lateral epicondylitis. Epicondylitis is here. Okay, and golfer's elbow is medial epicondylitis. Medial condylitis is the inner part. Golfer's elbow is the inner part. Okay, tennis elbow is the outer part. This is the inner part. Due to repeated rotation of the forearm, in combination with bending of wrist, especially when using a screwdriver, manual screwdriver. Symptoms, pain, burning sensation. Automobile workers develop this quite often. Okay, bursitis, like this, kind of scary, right? Repeated irritation or friction due to repetitive adduction, rotation joints, pressure over the bursa. Okay? This is a very complex design. Look at that. The joint, the bursa. Trigger finger. Many people develop this when they overuse the typewriter, the keyboard. It's like this. This is a tendon, right? Connecting the fingers and the forearm. It's got swollen. Okay? And when you got swollen something, this tendon cannot go through here smoothly. It got stuck like this. So whenever you bend, it doesn't go back anymore because it's stuck somewhere. Okay? So it's a thickening of tendon and tendon sheaths in fingers or thumb, or formation of a nodule like this on the tendon. The symptom is snapping action of affected finger. Snapping means this. When you bend, it got stuck, and then you have to passively move it. So it's got, whenever you try to return to an open palm, you feel that it's snapping. Okay, locked. Trigger finger. And this one is de Quervain's disease. Okay. It's here. And the test is called Finkelstein's test. It's very simple. Try to hold a fist like this with your thumb inside, and then bang like this. If you feel it hurts, then you got a problem. Okay. Hold it and then bend as much as you can. Does it hurt? Okay. The symptom is pain during thumb motion, swelling, a cracking noise during moving. Yeah, I hear some cracking noise. You need to see the doctor? No, I'm just bluffing. Okay. The cause is repetitive friction between some tendons and their sheaths. Okay, again, just repetitive use. Who will develop this? This is also called mother's hand syndrome. Mother's hand syndrome. Many mothers develop this. Cooking.
Okay, yeah.
dishwashing, also cook, chef. Okay, in the restaurants, you're using a lot of this motion. Okay, finally, if you collect all of these possible hypotheses and causes, you get this. It's called risk factors. Risk factors of this problem. And exact cause and effect relationship cannot be established so far. This is the conclusion. And I don't believe in the next 20 years we can confirm anything. Because it's impossible to run experiments until you develop this disorder. And can you use a monkey to do it for you to type and then prove that the typing motion is bad? And can you do an experiment on the mouse? This is not unlike medical experiment. This is ergonomics. That's a big problem. You cannot never run the experiment to prove it. So an exact cause and effect relations cannot be established. So we are always collecting data statistically. So we've been doing big data already. It's been many, many years. We're trying to collect as much as possible, trying to find the correlations between so many different variables so that we can quantify and establish a threshold limit. But it's very difficult. But so far, this is what we know. If the motion is highly repetitive, if the cycle length is less than 30 seconds, this is actually what happened all the time. We are always aiming at less duration of the cycle. That's what industrial engineering is always doing. Then the human operator will repeat the motion all the time. And awkward postures, excessive forces, inadequate tool handles. I think we've been improving, okay, using a better to reduce the force, right? Pinch hand positions, low frequency vibration, gloves. Wearing gloves is a risk factor. Low temperature. So low temperature logistics creates also another problem. All these combined together, and in some cases, like these diseases, like these problems, we call it a prevalence rate. Okay, maybe 1 in 100. One person developed per 100 people. Maybe 5 in 100. Maybe 1 in 1,000. Maybe 1 in 10,000. If it's very low, it's not a problem. Usually it's not. It's in the order of like 1%, 3%, even 10%. That's becoming a problem. Carpal tunnel syndrome is very common. This one today, if you just Google it, you know it's very common. All the clinics, they report this problem, carpal tunnel syndrome. So there's a very, very strong evidence to show that using computer keyboards, using the mouse, because that's what happened today. If you compare to people 30 years ago, Today, we use these so often. 30 years ago, we don't have this. 40 years ago, there is nothing like this, CTS. Okay. All right. We finished. Okay. And the exam. Okay. You need to. You just need to know to review the things that I covered. Okay. Especially I emphasized during my lecture. Okay. And how to use the equations. Okay. Yeah. And the form will be similar, but this time I think there will be more questions for using equations. Okay.
Do we have to memorize the equations?
Oh, okay.
Yeah.
Because this time more equations. Okay. So open notes. Open notes. Okay. So the type probably different. Okay. The first time we have true and false, right, and selection. But this time probably essay plus the calculations. Okay. So open notes. Open notes. You can bring it. Just make sure you know how to use that equations. Okay. Okay, that's it for today, and see you 2 weeks from now.